Hello, everyone. I'm Dr. Brandi Sandstrom. I'm a veterinarian here in Louisiana and a student at Louisiana State University at Shreveport in the Master of Public Health program. I'll be presenting this overview of tularemia for human, animal, and environmental health professionals created by Dr. Susanne Straif-Bourgeois of the Louisiana Health Science Center at the School of Public Health. We are both members of the Animal Welfare Committee for the Gulf South Vector Program. This presentation is intended as a short and comprehensive disease overview for all human, animal, and environmental health professionals. We would appreciate your feedback, so please email all comments and questions to either Dr. Straif-Bourgeois or myself at the contact information listed here. Tularemia is also known as rabbit fever or deer fly fever. Tularemia is a potentially serious illness which is caused by the bacterium Francisella tularensis. Both humans and animals can become infected with Francisella. The bacterium was recognized in 1911 in Tulare County in California. It was renamed later in 1974 after Dr. Edward Francis, who linked the bacteria to deer fly fever in 1928. Francisella tularensis bacteria can survive in a moist environment, such as the soil, for weeks to months. It has a very low infectious dose at 10 to 50 bacteria that are sufficient enough to cause infection in both humans and animals. Both human and animal cases are reportable in the United States. The reporting of human tularemia cases ended in 1995, but was then reinstated as a reportable disease in 2000 because of concerns that Francisella tularensis could also be used as a biological weapon. Tularemia is also reportable as an animal disease. Animal tularemia has been found in every state except for Hawaii. The states of Arkansas, Missouri, Oklahoma, and Kansas contribute to more than 50% of all animal tularemia cases in the United States. Many wild and domestic mammal species are susceptible to tularemia, such as sheep, cats, dogs, pigs, and horses. Cattle seem to be resistant to the disease, even though when they are infected, they still show an antibody response. The disease is also known as rabbit fever because rabbits, hares, and rodents are especially susceptible to infection and often die in high numbers during a disease outbreak. Furthermore, skunks, squirrels, prairie dogs, muskrats, and beavers are natural hosts for Francisella bacteria. As mentioned earlier, cats, dogs, pigs, and horses can become infected with tularemia. Unfortunately, cats once infected can become very ill with a high fever and often die from tularemia. Francisella is mainly transmitted by the dog, wood, or lone star ticks, or by deer flies. Humans can become infected if they have skin contact with an infected animal, such as a rodent, hare, rabbit, sheep, or cats. People can become infected by drinking contaminated water or inhaling contaminated agricultural or landscaping dust. Since the bacteria is highly infectious, laboratory personnel are at a higher risk and have to be very careful when trying to grow the bacteria in culture. Animals can also become infected when drinking contaminated water or by killing and/or eating infected rodents. It is very important to remember that tularemia cannot be transmitted from person to person. The signs and symptoms in humans vary between mild to life-threatening and depend on how the bacteria enters the body. All forms are accompanied by fever and can be as high as 104 degrees Fahrenheit or 40 degrees Celsius. The most common form is the ulceroglandular form, which are skin ulcers including swollen lymph nodes. This form can occur through either tick or deer fly bites or handling infected animals. Additionally, the eye or the back of the mouth can be infected as well. The form affecting the lungs, the pneumonic form, is the most serious form of tularemia. It occurs when dust or aerosols containing Francisella bacteria are inhaled. Symptoms with this form include cough, chest pain, and difficulty breathing. It can also occur when other forms of tularemia are left untreated and the bacteria spread through the bloodstream to the lungs. Signs and symptoms in animals depend on how they became infected and varies with species. Cats range from mild to severe symptoms. They can exhibit high fever, lethargy, loss of appetite, swollen lymph nodes, enlarged liver, open sores in the mouth and the tongue with abscesses, as well as vomiting and diarrhea, coughing, nasal discharge, difficulty breathing, and jaundice. In septicemia, when bacteria enter the bloodstream, cats are likely to die, even when treated early on. In contrast, dogs are less susceptible to tularemia. Their clinical signs include mild fever, lethargy, poor appetite, swollen lymph nodes, inflamed or runny eyes, a runny nose, or draining abscesses. Signs and symptoms are a bit different in large animals and farm animals. Infected horses might develop fever, difficulty breathing, incoordination, and exhibit depressive behavior. Infected horses often have extensive tick infestation. In sheep, tularemia normally presents as a seasonal disease, coinciding with being put out to pasture, and they are more likely to be infested with ticks as well. Clinical signs in sheep include fever, rigid gait, diarrhea, frequent urination, weight loss, and/or difficulty breathing. Sick sheep may isolate themselves from the remainder of the flock. The fatality rate is highest in young and pregnant sheep. Pigs infected with tularemia show varying degrees in signs and symptoms. Again, cattle do not show any signs and symptoms, even though they can still have a detectable antibody response after infection. We have no data on naturally infected wildlife, but experimentally infected rabbits, hares, and rodents show general weakness, fever, skin ulcers, swollen lymph nodes, and abscesses. Death usually occurs 1 to 2 weeks after onset of signs and symptoms. To reach diagnosis, Francisella tularensis should be isolated from a clinical specimen. Appropriate specimens include scrapings of ulcers, conjunctival swabs, lymph node aspirates or biopsies, and blood or respiratory specimens. This all depends on the form of illness. Because of the slow-growing nature of Francisella bacteria in culture media and the increased risk of exposure of lab personnel, repeat serology testing, meaning a seroconversion from negative to positive IgM and/or IgG, is recommended for a tularemia diagnosis. The first serum sample should be collected during the acute phase of illness, which is within the first week of onset, and the second serum sample should be then collected 2 to 3 weeks later. It is important to alert laboratory personnel working with the culture if tularemia is suspected due to human risk and so that cultures can be incubated for extended periods due to the fastidious and slow-growing nature of the bacterium. Antibiotic treatment, such as tetracycline or doxycycline treatment, is recommended for mild human cases and is given orally. Streptomycin or gentamicin treatment is recommended for severe cases, given either IV or IM. Antibiotic treatments may need to be adjusted depending on a person's age, medical history, underlying health conditions, pregnancy status, or allergies. You can read about the most updated treatment guidelines from the Infectious Disease Society of America at the website listed here. In lab personnel, post-exposure prophylaxis is recommended after being exposed to Francisella. Doxycycline at 100 milligrams orally twice daily for 10 to 14 days is generally recommended for prophylaxis in adults. As an alternative, ciprofloxacin at 500 milligrams orally twice daily for 10 to 14 days can be given to patients unable to take doxycycline. A vaccine is not available for the general public in the United States, but a vaccine is currently under review by the United States Food and Drug Administration for lab personnel who work routinely with Francisella bacteria. Here on the United States map, you will see all reported tularemia human cases in 2022. As with animal tularemia, we see most human cases are reported from Arkansas, Missouri, Oklahoma, and Kansas. By looking at the seasonal distribution of human tularemia cases, we see that most cases occur in the summer months and warmer temperatures while people are enjoying outdoor activities such as camping, hiking, or hunting. In consideration of prevention for humans, people who hike, camp, or work outdoors should use Environmental Protection Agency registered insect repellents as per product instructions. Please also wear long pants, long sleeves, and long socks to keep ticks and deer flies off of your skin. Please check yourself and your family after having been outdoors. Please remove attached ticks promptly with fine-tipped tweezers. For correctly removing ticks from your skin, please watch the short YouTube video from the CDC listed here. And finally, while outdoors, please do not drink from any untreated water surfaces. When mowing or landscaping, please do not mow over sick or dead animals. When possible, please check the area for carcasses prior to mowing. The use of masks during mowing and other landscaping activities may reduce your risk of inhaling Francisella bacteria, but this has not yet been scientifically proven as a method of prevention. If you hunt, trap, or skin animals, please use gloves when handling animals, especially rabbits, muskrats, prairie dogs, and other rodents. Please cook game meat thoroughly before eating. Prevention and control for animals are very similar to the preventative measures in humans, mainly to limit exposure to ticks. Please use pet-friendly insect repellents and routine flea and tick preventions in domestic animals. Please regularly check animals for ticks and carefully remove attached ticks promptly using fine-tipped tweezers. The Canadian Veterinary Medical Association has developed a short YouTube video on how to remove a tick from your pet. Furthermore, please keep your animals away from sick or dead wild animals, especially rabbits, hares, and rodents. And please thoroughly cook any wild game before feeding the meat to your animals. You may also want to prevent animals from drinking untreated surface water while outdoors. These are references for the presentation with hyperlinks. Please let us know if you have any questions or comments, and please direct those to the contact information listed on the first slide of this presentation. And thank you for your time and your attention.